A little bit lower. Yeah, that's it, right there.
Breath in. Now relax.
Oh yeah.
For a lot of people, those adjustments look like a form of therapy, something to make you feel better. For sane people who are not familiar with chiropractic, it probably just looked a little freaky. What I want to do is demystify the adjustment, talk about why somebody would need something like that and how it works. But first, it's important to understand that the entire spine, it's supposed to move in unison. Everything is supposed to move together, have coordinated movement. When a certain area gets stuck, you get tension, you get restrictions, causes misalignments, and that interferes not only at that area where it's stuck, but it also interferes with the entire ability of the spine to move properly. So for example, if somebody can't extend properly through their mid-back, it is going to create a situation where they have poor posture, and that strains not only that area in that mid-back, but it will affect the neck and the low backs. We apply an adjustment, it helps get that restriction out of there, realigns the spine so they can have a better, fuller posture. As another example, if somebody can't move their head and neck symmetrically, for example, they can turn really well in one direction, but going in the other direction, it's just stuck, it's restricted. That will not only affect the neck, but it could possibly affect the entire spine all the way down. So as you watch me palpate this neck, as I go to the left, they have a full range of motion and a nice springy feel within that joint. That is the sign of a good, healthy joint. As I go to the right, not only does it not have as much range of motion, but it feels stuck. It has what's called a hard feel to it. That's one area or one way we know that's where we need that adjustment. As we do the adjustment, it gives it a better, fuller range of motion and realigns that area of the neck. So the mechanical approach of a spinal manipulation is to align the joints of the spine, give a fuller range of motion, better posture, and less pain. Now, a second way that these adjustments work is by stimulating the brain, stimulating the nervous system, where the adjustment acts as a type of a restart or a reboot for the central nervous system. Now, how this works or why this works is because all along the spine, we've got these joints and we've got these deep muscle fibers that are loaded with special types of nerve receptors. And those nerve receptors act as position sensors or body awareness sensors. As we do the adjustments in the correct area, we stimulate those nerve receptors, those body awareness sensors, and it sends information to the brain, and it changes the way that the brain processes information. It changes the way that the brain sends information back to surrounding muscles and even muscles into our extremities. So you can take somebody who has maybe poor coordination, poor movement within their arm or their shoulder. We can do the spinal adjustment in the correct area. And after that adjustment, it could actually change the way that somebody moves their arm or their shoulder. Now, spinal manipulation in the low back can even reduce muscle spasms, and again, that's neurologically, that's a neurological reflex. So you can have somebody that has low back pain. Not only do they probably have those misaligned joints, but because of that, they have a secondary source of pain, which is that muscle spasm. We can perform that spinal manipulation. Relax. And after that adjustment, not only is that going to realign that joint, but it's going to relax the surrounding muscles, and it also has a release of some neurotransmitters that are pain relieving, so you get the added bonus of pain relief out of this. So some newer and really exciting research is also showing that these spinal manipulations can have an even deeper effect on the nervous system. They can have a calming effect on the nervous system. A lot of us can relate to having stress in our bodies. There's so many people walking around in this chronically stressed state. And as we allow that stress, that it manifests as tension in the body. And chronic stress, it decreases the ability for the body to digest food properly. It decreases the immune system. It decreases the body's ability to heal properly. It causes people to be tired, sluggish, fatigued. So it is really exciting to see that we have another mechanism. The spinal adjustment has this deeper influence on the nervous system. It allows us to relax, to calm down. Now, a lot of this newer research, it's not really a surprise to chiropractors that have been practicing for a while. After people finish a treatment plan, a lot of times they will ask, is it okay if I continue with chiropractic care even if I don't have pain, if I don't have that issue anymore? The reason they ask that is because they just report that I feel overall better after these manipulations. I do feel healthier, and they're probably experiencing some of those benefits that we just mentioned. So that's an added way, that's another way that some people choose to use these kinds of services, to use chiropractic care. It's more of a wellness approach, just an overall, I want to feel better, I want to be as healthy as I possibly can. So I hope that you've liked this video, I hope that you learned something, and of course if you have any questions, if you're curious, you want to learn more, please give us a call anytime. We're happy to answer any questions.